1. What is the primary mode of transmission for tuberculosis? A. Direct skin contact. B. Contaminated food. C. Airborne droplets. D. Blood transfusion. Answer: C. Airborne droplets. Rationale: tuberculosis is primarily transmitted through airborne droplets expelled when an infected person coughs, sneezes, or speaks. Direct skin contact, contaminated food, and blood transfusion are not common modes of TB transmission. 2. Which of the following is the most common symptom of active pulmonary TB? A. Night sweats.
B. Hemoptysis.
C. Persistent cough lasting more than 3 weeks. D. Weight gain. Answer: C. Persistent cough lasting more than 3 weeks. Rationale: a persistent cough lasting more than 3 weeks is the hallmark symptom of active pulmonary TB. Night sweats, hemoptysis, and weight loss are also symptoms, but the most common and consistent one is a prolonged cough. Weight gain is not a symptom of TB. 3. Which diagnostic test is considered the gold standard for confirming tuberculosis? A. Tuberculin skin test (TST). B. Chest X-ray. C. Sputum culture. D. Interferon gamma release assay (IGRA). Answer: C. Sputum culture. Rationale: the sputum culture is the gold standard for confirming TB because it allows for direct identification of Mycobacterium tuberculosis. The TST and IGRA are screening tests, and a chest X-ray can suggest TB but does not confirm the diagnosis. 4. What is the recommended first-line treatment regimen for drug-sensitive TB? A. Rifampin, isoniazid, pyrazinamide, ethambutol. B. Amoxicillin, ciprofloxacin, clarithromycin, doxycycline. C. Vancomycin, linezolid, clindamycin, metronidazole. D. Acyclovir, oseltamivir, azithromycin, prednisone. Answer: A. Rifampin, isoniazid, pyrazinamide, ethambutol. Rationale: the RIPE regimen, rifampin, isoniazid, pyrazinamide, ethambutol, is the standard first-line treatment for drug-sensitive TB. The other drug combinations are used for bacterial, viral, or other infections and are not effective against Mycobacterium tuberculosis. 5. Which vaccine is used to prevent tuberculosis? A. Bacillus Calmette-Guerin (BCG). B. Pneumococcal vaccine. C. Influenza vaccine. D. Hepatitis B vaccine. Answer: A. Bacillus Calmette-Guerin (BCG). Rationale: the BCG vaccine is used to prevent TB, particularly in high-risk countries. The pneumococcal, influenza, and hepatitis B vaccines protect against other diseases and do not provide immunity against TB. 6. What is the most common site of extrapulmonary TB? A. Lymph nodes. B. Kidneys. C.
Spine. D. Brain.
Answer: A. Lymph nodes. Rationale: extrapulmonary TB often affects the lymph nodes, especially in children. The spine, kidneys, and brain can also be involved, but the lymph nodes are the most common site. 7. What is the primary function of the Mantoux tuberculin skin test? A. To diagnose active TB. B. To identify latent TB infection. C. To monitor treatment efficacy. D. To detect drug resistance. Answer: B. To identify latent TB infection. Rationale: the Mantoux test is used primarily to detect latent TB infection by identifying an immune response to Mycobacterium tuberculosis. It is not used to diagnose active TB or monitor treatment efficacy. 8. Which of the following is a common side effect of rifampin, a drug used in the treatment of TB? A. Jaundice. B. Dizziness. C. Weight gain. D. Rash. Answer: A. Jaundice. Rationale: rifampin can cause liver toxicity, resulting in jaundice. Dizziness, weight gain, and rash are less common side effects. Liver function should be monitored during treatment. 9. What is the primary role of the Bacillus Calmette-Guerin (BCG) vaccine in TB prevention? A. To prevent all forms of TB. B. To prevent drug-resistant TB. C. To prevent TB meningitis in children. D. To treat active TB. Answer: C. To prevent TB meningitis in children. Rationale: the BCG vaccine is primarily used to prevent TB meningitis and severe forms of TB in children. It does not provide complete protection against all forms of TB, especially pulmonary TB in adults. 10. Which of the following is a key characteristic of multi-drug resistant TB, MDR-TB? A. Resistance to one first-line drug. B. Resistance to at least 2 first-line drugs. C. Resistance to all drugs. D. Easy to treat with standard regimens. Answer: B. Resistance to at least 2 first-line drugs. Rationale: MDR-TB is defined by resistance to at least 2 of the first-line antitubercular drugs, rifampin and isoniazid. Resistance to all drugs is referred to as extensively drug-resistant TB, XDR-TB, which is even more difficult to treat. 11. Which of the following is a recommended isolation precaution for patients with active TB? A. Contact precautions. B. Airborne precautions. C. Droplet precautions. D. Standard precautions. Answer: B. Airborne precautions. Rationale: airborne precautions are required for patients with active TB as the bacteria are spread via airborne droplets. Contact, droplet, and standard precautions are not sufficient for TB. 12. What is the first step in the diagnostic process for a patient suspected of having TB? A. Perform a chest X-ray. B. Obtain a sputum sample for culture. C. Perform a tuberculin skin test, TST. D. Order a blood test for TB. Answer: C. Perform a tuberculin skin test, TST. Rationale: the first step in diagnosing TB is usually screening with a tuberculin skin test, TST, or an interferon gamma release assay, IGRA. Chest X-rays and sputum cultures are used to confirm the diagnosis of active TB. 13. Which of the following groups is at highest risk for developing active TB after a latent infection? A. Children aged 5 to 10 years. B. HIV-positive individuals. C. Pregnant women. D. Healthy adults. Answer: B. HIV-positive individuals. Rationale: HIV-positive individuals are at significantly higher risk for progressing from latent TB to active TB due to their compromised immune system. Children, pregnant women, and healthy adults are not at as high a risk. 14. What is the recommended duration of treatment for latent TB infection, LTBI? A. 2 months. B. 6 months. C. 9 months. D. 12 months. Answer: C. 9 months. Rationale: the recommended treatment for latent TB infection is a 9-month regimen of isoniazid. Shorter treatments may be used, but 9 months is the standard. 15. Which of the following is a common complication of untreated TB? A. Pneumonia. B. Respiratory failure. C. Heart failure. D. Hepatic failure. Answer: B. Respiratory failure. Rationale: untreated TB can lead to progressive lung damage, which can result in respiratory failure. Pneumonia and heart failure are not typically complications of untreated TB, although pneumonia can occur as a secondary infection. 16. Which of the following medications is most commonly associated with hepatotoxicity in the treatment of TB? A. Rifampin. B. Pyrazinamide. C. Isoniazid. D. Ethambutol. Answer: C. Isoniazid. Rationale: isoniazid is known for its potential hepatotoxicity. While other drugs like rifampin and pyrazinamide can also cause liver damage, isoniazid is the most commonly associated with a side effect. 17. A patient with active TB is prescribed a 4-drug regimen, RIPE. Which of the following drugs must be monitored for ocular toxicity? A. Rifampin. B. Ethambutol. C. Isoniazid. D. Pyrazinamide. Answer: B. Ethambutol. Rationale: ethambutol can cause ocular toxicity, including optic neuritis, which can affect vision. Rifampin, isoniazid, and pyrazinamide have different side effect profiles, but not ocular toxicity. 18. Which of the following is a sign of severe TB disease progression? A. A mild cough with minimal sputum. B. Fatigue, night sweats, and weight loss. C. Clear chest X-ray with no symptoms. D. Sudden onset of fever and chills. Answer: B. Fatigue, night sweats, and weight loss. Rationale: fatigue, night sweats, and weight loss are classic signs of severe TB disease progression, indicating that the infection is becoming more systemic. Mild cough or clear X-ray does not suggest severe disease. 19. Which TB drug is contraindicated in patients with a history of optic neuritis? A. Rifampin. B. Isoniazid. C. Ethambutol. D. Pyrazinamide. Answer: C. Ethambutol. Rationale: ethambutol can cause optic neuritis and is contraindicated in patients with a history of this condition. Rifampin, isoniazid, and pyrazinamide do not have this effect. 20. A patient on TB treatment with the RIPE regimen complains of orange-colored urine. Which medication is most likely responsible? A. Rifampin. B. Isoniazid.
C. Ethambutol.
D. Pyrazinamide. Answer: A. Rifampin. Rationale: rifampin is known to turn urine, sweat, and tears an orange color. This is a harmless side effect of the medication. The other medications do not cause this discoloration. 21. Which of the following is a primary risk factor for developing TB? A. Obesity.
B. Smoking. C. Diabetes.
D. HIV infection. Answer: D. HIV infection. Rationale: HIV infection is the primary risk factor for developing active TB due to the immune suppression it causes. Obesity, smoking, and diabetes are also risk factors, but HIV significantly increases the likelihood of progressing from latent to active TB. 22. Which of the following is a common diagnostic imaging technique for evaluating TB-related lung damage? A. MRI of the chest. B. CT scan of the chest. C. Chest X-ray. D. Ultrasound of the chest. Answer: C. Chest X-ray. Rationale: chest X-ray is the most common imaging technique used to evaluate lung damage from TB. MRI and CT scans may be used in specific cases, but the chest X-ray is the standard for TB diagnosis. 23. Which of the following should be included in patient education for TB treatment adherence? A. Discontinue medication once symptoms improve. B. Take all medications as prescribed, even after feeling better. C. Only take the medication for 2 weeks. D. Skip doses if feeling nauseous. Answer: B. Take all medications as prescribed, even after feeling better. Rationale: it is crucial that patients complete the full course of TB treatment to prevent relapse and drug resistance. Stopping medication early can lead to incomplete eradication of the bacteria. 24. In TB treatment, what is the role of pyrazinamide in the regimen? A. To reduce cough. B. To treat drug-resistant TB. C. To kill dormant TB bacteria in acidic environments. D. To prevent liver toxicity. Answer: C. To kill dormant TB bacteria in acidic environments. Rationale: pyrazinamide is effective against dormant TB bacteria that may reside in acidic environments in the body, such as within granulomas. It is not used to treat drug-resistant TB or reduce cough. 25. What is the most effective method for preventing TB transmission in a healthcare setting? A. Wearing gloves when handling patients. B. Isolation of patients with active TB. C. Administering the BCG vaccine. D. Using antibiotics on all healthcare workers. Answer: B. Isolation of patients with active TB. Rationale: isolating patients with active TB, particularly using airborne isolation precautions, is the most effective way to prevent transmission. Gloves, the BCG vaccine, and antibiotics for workers are additional precautions, but not as effective as isolation. 26. A patient with TB is receiving rifampin. Which of the following should be monitored regularly during treatment? A. Blood glucose levels. B. liver function tests. C. Kidney function tests. D. Complete blood count (CBC). Answer: B. Liver function tests. Rationale: rifampin can cause liver toxicity, so liver function tests should be monitored regularly. Blood glucose, kidney function, and CBC are not commonly affected by rifampin. 27. Which of the following statements about the treatment of active TB is correct? A. Treatment for active TB usually lasts for 6 weeks. B. Treatment typically involves a combination of drugs for at least 6 months. C. Treatment can be completed in less than a month with appropriate medications. D. Treatment involves a single drug for short-term therapy. Answer: B. Treatment typically involves a combination of drugs for at least 6 months. Rationale: active TB treatment usually involves a combination of 4 drugs for at least 6 months to ensure effective eradication and prevent resistance. 28. Which of the following medications is a first-line treatment for TB? A. Doxycycline. B. Isoniazid. C. Levofloxacin. D. Acyclovir. Answer: B. Isoniazid. Rationale: isoniazid is one of the first-line medications used to treat TB. Doxycycline, levofloxacin, and acyclovir are not first-line treatments for TB. 29. A nurse is educating a patient who has been diagnosed with latent TB infection. Which statement by the patient indicates a need for further teaching? A. I will take my medication exactly as prescribed for 9 months. B. I will not spread the infection to others because it is latent. C. I can stop my medication if I start feeling better. D. I will follow up with my healthcare provider to monitor my progress. Answer: C. I can stop my medication if I start feeling better. Rationale: the patient should complete the full 9-month course of medication, even if they start feeling better. Stopping medication early can result in the reactivation of the infection. 30. Which of the following TB drugs can cause peripheral neuropathy as a side effect? A. Isoniazid. B. Rifampin. C. Pyrazinamide. D. Ethambutol. Answer: A. Isoniazid. Rationale: isoniazid can cause peripheral neuropathy as a side effect, especially in patients with pre-existing conditions like diabetes or alcoholism. Pyridoxine, vitamin B6, is often prescribed to prevent this side effect. 31. What is the recommended method for diagnosing drug-resistant TB? A. Sputum smear microscopy. B. Chest X-ray. C. Culture and drug susceptibility testing. D. Mantoux tuberculin skin test. Answer: C. Culture and drug susceptibility testing. Rationale: drug-resistant TB is diagnosed through sputum culture followed by drug susceptibility testing to identify resistance patterns. Smear microscopy and chest X-rays are helpful, but do not diagnose drug resistance. 32. A patient with TB infection has a history of liver disease. Which of the following TB medications should be used with caution? A. Rifampin. B. Isoniazid. C. Ethambutol. D. Pyrazinamide. Answer: B. Isoniazid. Rationale: isoniazid is metabolized in the liver and can cause hepatotoxicity, so it should be used with caution in patients with liver disease. Rifampin, ethambutol, and pyrazinamide are also liver metabolized, but isoniazid poses a higher risk. 33. A patient is receiving TB treatment and develops a rash and fever. What should the nurse's priority action be? A. Administer antipyretics and monitor for further symptoms. B. Continue TB medications as prescribed. C. Discontinue TB medications and notify the healthcare provider. D. Encourage the patient to drink fluids and rest. Answer: C. Discontinue TB medications and notify the healthcare provider. Rationale: a rash and fever could indicate a hypersensitivity reaction to TB medications. The medications should be discontinued, and the healthcare provider should be notified for further evaluation. 34. Which of the following statements about the transmission of TB is correct? A. TB is only spread through blood. B. TB can be spread through the air when an infected person coughs or sneezes. C. TB is not contagious unless the patient has symptoms. D. TB can only be transmitted by direct contact with an infected person. Answer. B. TB can be spread through the air when an infected person coughs or sneezes. Rationale. TB is an airborne disease, meaning it is transmitted through respiratory droplets when an infected person coughs or sneezes. 35. A patient with TB is receiving treatment with rifampin and isoniazid. Which of the following side effects should be monitored closely? A. Hypertension. B. Visual disturbances. C. Liver toxicity. D. Constipation. Answer. C. Liver toxicity. Rationale. Rifampin and isoniazid are both hepatotoxic medications, so liver function should be monitored regularly. Hypertension, visual disturbances, and constipation are not common side effects of these medications. 36. A nurse is providing education about TB treatment. Which statement by the patient indicates that they understand the importance of completing the entire course of therapy? A. I can stop the medication once I feel better. B. I will take my medication for 3 months instead of 6 months. C. Stopping the medication early can cause the TB to come back. D. I will only take the medication if I feel sick. Answer. C. Stopping the medication early can cause the TB to come back. Rationale. Completing the full course of treatment is essential to prevent the reactivation of TB. Stopping early can lead to resistance and a recurrence of the infection. 37. Which of the following patients is at highest risk for developing TB? A. A 45-year-old smoker with a history of asthma. B. A 30-year-old diabetic with poor glucose control. C. A 60-year-old HIV-positive individual. D. A 25-year-old pregnant woman. Answer. C. A 60-year-old HIV-positive individual. Rationale. HIV-positive individuals are at a much higher risk for developing active TB due to their weakened immune system. Smoking, diabetes, and pregnancy can also increase risk, but to a lesser extent. 38. A patient with TB infection asks if they can return to work after starting treatment. What is the nurse's most appropriate response? A. You can return to work after 2 weeks of treatment. B. You should wait at least 4 weeks before returning to work. C. You are contagious for up to 6 months, so you must stay home. D. You can return to work once your symptoms are gone. Answer. A. You can return to work after 2 weeks of treatment. Rationale. Most patients with TB are no longer contagious after 2 weeks of treatment with appropriate medications. They can return to work after this period, assuming they are feeling better. 39. Which of the following is a major goal in the treatment of multi-drug-resistant TB, MDR-TB? A. To complete treatment in 6 weeks. B. To administer a combination of first-line drugs. C. To prevent the development of drug resistance. D. To use second-line drugs to eradicate the bacteria. Answer. D. To use second-line drugs to eradicate the bacteria. Rationale. MDR-TB requires treatment with second-line drugs, as the bacteria are resistant to first-line medications. The goal is to effectively treat the infection while minimizing resistance. 40. What is the primary reason for directly observed therapy, DOT, in TB treatment? A. To ensure the patient receives the correct medications. B. To monitor for side effects of the medications. C. To improve the patient's adherence to the treatment regimen. D. To reduce the cost of TB treatment. Answer. C. To improve the patient's adherence to the treatment regimen. Rationale. Directly observed therapy, DOT, ensures that the patient adheres to the treatment regimen, which is critical for preventing drug resistance and recurrence of TB.